So that's the partnership of trust. Now this is the second point. I believe there's a paradigm shift taking place. It actually started on the 1st of May in this practice, and I'll tell you why. There's 6 points there that gives the basis. The first was that we needed, as a healthcare organisation, to move from paper-based records to an electronic one. You simply cannot do any of the stuff that I'm going to be showing you until you have an electronic system. And general practice, we moved about 10 years ago from paper-based records to an electronic one. How long have you had a system here for? IT system?
Yeah, 96.
Yeah, so you've longer than me, so you've had it 14, 15 years. But that was step one. You had to move to an IT-based one. The second step was the internet itself. It needed to be everywhere. It needed to be available everywhere so that people can access it. And now it is available absolutely everywhere. On your mobile phones, a lot of people have computers and broadband. The library, there's a big, big push for every single household in the UK. We've heard on the news yesterday. Every single household is going to have broadband, and that's something that the government has pledged. So the fact that the internet is everywhere, that was the second step. The third step was that actually, when I first started as a GP back in 2000, and I would ask some sort of weird and wonderful questions, and I'd get something like a stethoscope and stick it in my ears and put it on someone's chest and suddenly say to somebody, you've got a chest infection, you're actually having a heart attack, and you haven't got a clue about. People used to think that was voodoo. But actually, as a result of things like ER, Holby City, Casualty, the TV programmes in the mornings, the magazines, the newspapers and whatnot, that voodoo that we used to practice has become less so. I actually sometimes occasionally get patients thinking, can I have a CBC diet? Having read ER, watched ER. There seems to be an increase in the level of understanding generally amongst the public about health issues and how we might approach things, and I think that was a really important factor. The fourth was that IT system that we've got in the surgery that allows us to do our business. If we can allow patients via the internet to access the same information, then something interesting starts to happen. But actually, it goes further than that. It's no good you knowing that I've got back pain and I've had a scan done and it shows that I've got a disc prolapse. I need to start to think about what choices have I got in terms of how to treat it. Now that's where the choice agenda becomes so important in understanding why healthcare is going this way. Because if you know where your health is, and you understand what choices you have because you've gone to your clinician who's the expert, but you've also gone to things like the map of medicine that give you the different options that are available, then guess what? Something really interesting happens. Actually, when a patient is allowed to choose whether they want tablets for their depression or whether they want talking therapies, and they've had an opportunity to look at the advantages and disadvantages of both, and have chosen to go for talking therapy, they're more likely to turn up to those appointments, they're more likely to get the full treatment, and they're actually more likely to therefore reach a better conclusion. So choice leads to better outcomes. Now that's the basis of what I think is the paradigm shift that's taking place. And it's something that happens almost overnight because of this fact. The moment an organisation decides, so for you it was the 1st of May, that your patients now can have access to their records, the paradigm shift happens. You've suddenly moved your whole patient population into a completely different world where they can start doing these things. So what, you're on the turn around. 1st of May, you know, it's the 17th of June and we've got 15 patients who've got access to their records. Whoopie-doo! It's not exactly lit the fire, has it? But wait a minute, it's 7:20, 7:30 here. Just imagine for a moment if one of you was to suddenly collapse on the floor and have an arrest. What would we do? Well, we've got clinicians here, doctors and nurses and perhaps first aiders, get down on our knees and we start doing basic life support. First step is to shout help. Someone goes to the telephone and calls 999. Whilst the doctors and nurses are doing what they're doing, the question of course we're all asking is, why is this person who was completely fine half an hour ago suddenly collapsed? And there's all sorts of thoughts going through their mind. Have they had a heart attack? Have they had a stroke? Were there any nuts in any of those pizzas? Have they suddenly developed some sort of allergic reaction to something or another? Are they diabetic and they haven't eaten anything and are they hypo? You know, do they suffer with epilepsy? Is it some sort of strange condition that they're being said? We haven't got a clue. And you sit there and think about, well, what do we need to do now in 2009 for that individual to try and ensure that they get the best care possible? So that when that ambulance crew arrives here, takes the patient and takes them up to the A&E department and then gets assessed and all the rest of it, that the doctors have the best information about them. And you start to think about a world where you're thinking, well, we need to find out what's wrong with that person. How are we going to find that out? What kind of device are we going to have here, as opposed to having to go somewhere else? How are we going to get that information onto that device? And then you start thinking about this world of real-time digital medicine, where actually the information becomes available wherever you might be, anywhere in the world, whenever the need arises. And I say you, either as a clinician or as a patient who's suddenly needing access to information of some sort. I've given the ER view of being in an A&E department, but actually it might be something about you've watched on the TV and it's something about obesity. You're sitting there thinking, oh, I wonder what my height and weight is, what my body mass index is. I wonder what I can do to improve my health. So it doesn't have to be something urgent and immediate. It might be something very non-specific.